We'll briefly talk about the complications of pneumonia. Now, when we are talking about complications of a disease condition, we are not joking, all right? We are not talking about signs and symptoms. No. We are now saying this disease condition has been there for a very long time. So the disease condition is now going to the end stage, right? So that's the complication. So for pneumonia, we also have complications of pneumonia, which we'll be looking at it. So for the complications of pneumonia, one of the complications is for pleural effusion. Now, pleural effusion is, can you look at this lung? Can you look at this lung? Can you see that this lung now is shrinking in and bulk of the spaces is now being occupied by fluid? All right, that's pleural effusion, presence of fluid in the pleural cavity. All right, so pneumonia can go on and on and on and on to cause this problem, right? So this can actually compromise the lung function, because obviously this person will be having difficulties in breathing. Okay, this person will be having difficulties in breathing and all that, all right? Then empyema. Empyema is what? Purulent exudates in the pleural space or pleural cavity. Presence of pus. So now we are not talking about fluid anymore. If there's pus here, mucus, right? So that means there have been tissue death, there's tissue necrosis, tissues are decaying and all that. So we have presence of pus in the pleural space, and this can be a complication of pneumonia. So this is due to necrosis or breakdown of visceral pleural or spread of infection into the pleural, okay? Then this can lead to things like pleural adhesions or pleural or lung fibrosis. The lung will become as hard as it would. No function again, all right? So that's the complications. Then I think, okay, the last one we have abscesses or cavitary lesions. Can you see this one? Cavities. What is cavitary? Cavities, all right? Formation of holes like caves inside the lungs, all right? This is due to what? How will I say it? Tissue damage has been going on for a very long time, all right? So this is, you could have circumscribed locus of a liquefactive necrosis within the tissue associated with what? Necrotizing staphylococcus or streptococcus infections or gram-negative rods. Okay, so I think this is it for the possible complications. And when we are talking about, let me remind you guys again, when we are talking about complications of a disease, it's not signs and symptoms. It's the disease end stage. The person is dying. Okay, so these are the complications of what? Pneumonia.